Hello, welcome back. The topic today is insulin resistance and fatty liver. The previous videos we all seen about fatty liver and insulin resistance separately. But now, what is the relationship? What is the link between these two, fatty liver and insulin resistance? What is insulin resistance? It is nothing but there is insulin, but the body tissues or the cells cannot utilize. So what happens? Naturally, the sugar will rise. When the sugar rises, more insulin has to be secreted. More insulin, more sugar, it's converted into fat. The fat is deposited in the body like a body weight or even in the liver as a fatty liver. Okay, what is fatty liver? When 5 to 10% of the liver cells body by body weight is replaced by fat, it's called fatty liver. And as it goes, it can lead to cirrhosis or the chronic liver failure. But in a fatty liver, what happens? The insulin is not functioning properly. The cells, the insulin hepatocytes cannot function properly. Because of that, again, sugar rises, your liver secretes more glucose into the bloodstream. Again, insulin rises, but it's not effective, causing insulin resistance. So it's like a vicious cycle. They're all made for each other. Okay, suppose somebody has a diabetes and fatty liver, what to do? Very simple. Reduce your body weight by 10 percentage by any means. First, reduce your body weight by 10 percentage. Number one. Number two, diet. Of course, no carbs, no simple carbs or any sweets. Completely cut down the carbs and no food after 7 p.m. That's the best thing. Then next is very importantly exercise. At least 30 to 45 minutes of walking per day. No cheat days, no nothing. Because every day we are sleeping, every day we are eating the same way. There should be 45 minutes, 30 to 45 minutes of walking. Very important. The next very important is your sleep, especially in the night time, because the circadian rhythm is very important. So 7 hours to 8 hours of continuous sleep is very important. And apart from that, you have to treat whatever the diseases. Suppose you have a diabetes, it has to be treated. You have a thyroid, has to be treated. Cholesterol, that has to be treated. Obesity, that has to be treated. These are all metabolic syndrome. So the fatty liver will change, so it can improve the insulin resistance. The same way, even these weight reduction, all these things will reduce the insulin resistance. Very simply, 10% of weight reduction is very important. Thank you.